Good morning. I'm very happy to be here, and let's introduce my best friend, and you will soon discover why. Ori Shachar is the CEO of Fainmesser and Sidero. He's the former executive of the INCD, it's the Israeli National Cyber Directive. Actually, Ori is here because I asked him to join me to a talk where we're going to discuss everything we did together in A200, and then we're going to have to kill you all. So please bear with me with those few minutes. I think it's best we can see it. Actually, Ori is here because he was an executive director that actually fought and took the challenge to try and prevent and defend all those government institutions and companies from cyber attacks coming out of the country, some of them from other states and some of them from other kind of attackers that we're going to share some of our experience there and where it meets the area of healthcare. And we're here to maybe shed some light on where everything you read about cyber and hear about cyber, where it meets the area that you are all interested in is the healthcare domain. And so good morning, Ori.
Good morning.
Sorry for saying it's a morning. I'm not going to change.
Good afternoon, and thank you for inviting me. And it's an honor to be here with all of you and talk about this very fascinating area and the combination or the intersection between healthcare and the cybersecurity threats.
So I think the first thing that Ori and I discussed the way that cyber meets healthcare was around 10 years ago. You probably all heard about the accident with Dick Cheney's device. It was covered all over the news. I think, Ori, you talked about it with me 10 years ago. Maybe let's share what you know about it.
Yes. So I think it's a very good promo for the subject. What actually happened is that Mr. Dick Cheney was the Vice President of the United States. The story was published a decade ago, and he had many heart problems, and he was supposed to undergo an operation and receiving a pacemaker. And the Secret Service was concerned because this pacemaker had a Wi-Fi, wireless capability, meaning somebody could connect like a meter or 2 meters to adjust the pacemaker. And the concern was that this pacemaker would be used to assassinate the Vice President of the United States. So what they did is to take the pacemaker and to neutralize all the wireless capabilities before the operation. And this story happened while he was a vice president, meaning like 15 years ago. You can only imagine what could be done today with all the tech that you are talking about and all the medical devices and all the capabilities that are aimed to help people, but in the wrong hands under terrorists could be used against the people that you want to serve.
So getting back to your experience through the cybers lately, the last 10 years, what are the trends? What are the, let's say, the top trends and the reasons and the threats that everybody meet today?
Sure. So these are general trends, not specific for the healthcare system. So basically, what we're seeing in the last couple of years is that the attackers are having an enormous flourish and very complex and very sophisticated ecosystem. First, we have teams that this is what they're doing for their lives. They come in the morning and they attack organizations to gain financial gains, to provide extortion, and to gain money out of organizations. I think we are sitting in the healthcare system, so doing it on hospitals or harming governments is the most evil thing to do, but this is what they are doing for their living. And they are operating together. They have a complete ecosystem. When one could buy access that another one achieved, they are selling data, they are selling access capabilities, and they cooperate with each other to provide better for themselves, to be more successful as malicious actors. If we look at what is the most common attacks out there, there is the ransomware attacks. I'm sure a lot of you have heard about the ransomware attacks where the attackers attack an organization and then they encrypt the sensitive data and denying the operability of the business. So they encrypt all the sensitive systems and disable the systems, and they demand a ransom to release it. In the recent year, what we've seen is that they add to this practice an extortion. So they first hack into the systems, steal all their data, all the sensitive information, and then encrypt. And if the organization is reluctant to pay, they extort it and threaten to release the data. And some organizations, because of the fear of reputation or because of they cannot allow this sensitive information to be released, they pay because of this practice.
So taking that into the healthcare arena or sector, you know, I have a good friend. He's a head of he's a surgery. He's a head of one of those departments in Hillel Yaffe. You probably heard about this hospital and what happened a year ago. And I'm always fan of the fact that he described me what is going on when there is a cyber attack in the hospital. Everything is going back to papers and nothing is connected, and trying to do to understand the patient's files and all the data they were used to see on their computer in kind of a manual manner. It's a kind of a disaster. So maybe share with us what exactly those attackers are looking when they are attacking at the healthcare ecosystem. It could be hospitals, it could be pharma companies, it could be manufacturers, devices, whatever. You have some experience, you actually helped some of those companies, so maybe you can share with us.
Yes. So first of all, we see in the right area, this is just some examples from the last month. So the attacks on cybersecurity on healthcare sector is out there, this is happening. It's not like something of the news, it's an actual practical thing that's actually happening all over the world. Here we see institutions that are obligated to report, but there are many institutions that don't even report on cyber incidents. So in 2 minutes we will deal with a specific example, but if we look at the healthcare system, the risks are, some of the risks are identical to other organizations, meaning hospitals and pharmaceutical companies, they have money, and thus they are a very relevant target for cyber attackers. Another thing is that they have you have masses of sensitive information, both about your intellectual property and also about the employees, about the doctors, about the nurses, about the researchers, and also, of course, about the patients. And this is a major threat, and some of the health regulation is targeting towards that. Another thing, as we touched the incident with the Vice President of the United States, you have medical devices. For terrorist organizations who want to conduct terrorist activities in cyber, for maybe even countries that want to fight each other and harm each other, this could be, God forbid, but it could be a valid threat to harm medical devices. I don't know. Imagine what could happen to a country where the CT and the MRI capabilities are neutralized because of a cyber attack, God forbid. So this is a very big threat. And the last, Yorai, if you could touch the aspect of adversarial AI.
So actually, I couldn't hold myself, and I had to put something with AI into that talk. Must share with you the story of the adversarial AI. The thing is, we know to take images that the machine was trained to recognize a panda. We add some noise. It's not just a noise, it's a specific noise that we generate. And then we can make the machine think it's a gibbon. The same way we do that, there are researchers demonstrating how you could do that to a CT or X-ray or all kind of images that you provide through the healthcare, and then by adding, or let's say exposing the data to some manipulations, you can actually make the machine think differently. It means that we all know that AI is going more and more deeper into the healthcare industry, and we see all kind of solutions based on AI, on machine learning and deep learning. And there is a kind of a hack. It's not a hack, it's actually part of the mathematics, that if you manipulate it by adding some data that we as human can't notice, you can really make the machine think different. You see, for the humans, the pictures, the images are looking the same, but the machine will take a different decision. So this is adversarial AI, and it's kind of a way to disrupt the data and change it, and without encrypting it and without taking it, but taking control or actually causing damage. I will not go deeper how it is done, but the thing it's done on after the models are trained, meaning it can happen to all kind of systems using AI in all kind of stages. But I think I've said enough about AI. Let's go back and take one example and share all the process that went there.
Yes. So as we said, there are many attacks out there on the healthcare system. We chose one that was like almost over a year ago in Ireland, on Ireland's health service executive, which is a country-backed healthcare system responsible for many hospitals across the country. This is like a year and a half ago. We are in the middle of the COVID pandemic, and during this crisis, a very sophisticated group called Wizard Spider, they are supposedly, do not quote me, but they are supposedly Russian team, a very sophisticated one that is targeting organizations across the world, and they attacked this healthcare system and completely paralyzed it. They first extracted all the sensitive data of the patients and of the healthcare employees, and then they encrypted and paralyzed the entire systems within the healthcare system, demanding $20 million in ransomware. The Irish officials, the Irish government decided that they wouldn't pay, and so they tried to unlock their system and tried to get back to normal operation of the country. They had severe outages, so all the people in Ireland suffered because many elective procedures were delayed. So they told the public, do not come to the hospital. Do not come, we cannot serve you. Only critical operations were conducted, and they actually rebuilt their entire IT and communication and entire systems from scratch. It took them to get back to normal over 2 months, so they were mostly on board like a month and a half afterwards. But it took them 2 months and a lot of pain to get back to normal and to restore the healthcare system operating. And this is the quote from one official in the healthcare there. We are doing everything on paper. We are back to the 1970s. So this is an example of how a sophisticated, very ruthless actor can conduct an attack and actually cause a severe damage to a country and to a healthcare system.
Taking that example, could it be done differently? Is there anything to do to prevent those attacks? Because you mentioned, I think, and we might emphasize it, all organizations are under attack all the time. It's something continuous. It's not a sudden event. It's not happening one day. Usually attackers are playing all over the area and trying to penetrate organization or achieve some goals and, you know, put some flags on the way, sometimes for themselves, sometimes for the others, for the other attackers. And so it's a kind of a continuous fight, continuous battle. So what could be done differently to prevent those, you know, severe incidents or severe crises?
So first, as countries, as healthcare systems, there are now regulations that demand that hospitals and medical institutions would take care of their cybersecurity. So we have the HIPAA and we have other regulations worldwide aiming for the healthcare sector to be more ready. So we see a change. We see some hospitals, we see some medical institutions that take cybersecurity very, very seriously, and they are as secured as banks, or even more. And the threat is similar. So the threat is out there, as we discussed. What could you do? First, the basic idea is to know where all the hospital or organizational assets are. Where are the assets in the cloud? Where are the assets on-prem? Which offices do you have that sometimes you may forget about them? All the places that hackers could use to penetrate inside the organization. So this is the first. Next, this is a battle, as you said. You need to constantly know where your vulnerabilities are and close them, where you have the highest risks and try to mitigate them. For example, we touched the sensitive data. Where do you keep your patient's sensitive data and how you guard it in order that it would be very, very hard to penetrate and steal massively all the data. And then one of the things that is actually a thing that we are seeing over and over is organizations that they don't have backups. So you find an organization and they are, after the horses already flew away, they are trying to see where they have all the backups, and you see, okay, this guy has some of the backup in his computer, and this is a backup 2 years ago, and you do like a puzzle to assemble all the pieces and parts of the backup. So this is, if there is one takeaway here, please back up everything, know where the backups are. This is relevant for a fire, and this is relevant for a cyber attack as well. And the last thing is to have a plan ready for an incident, the cyber incident that could happen. So these are the things that, it's not an easy task, but it's something that my advice to you is to make sure that you are doing.
I think, well, from offensive perspective, I've never been a cybersecurity defender. I was the other side. Remember that those attackers are always there, and they will probably find the hack. They will find a way to go where they want. I think the way to live with that and be safe with that, and I know maybe do best when the crisis comes, is to first raise your bar, make it more difficult. So the way you raise your bar, you know the amount of attacks that could go over that bar. So you're already in a better place. And this is the regulation and everything. And we really have to sum up.
One sentence about that. I have a friend of mine who is a senior official in the British defense, cyber defense, and he said our goal as England is to raise the bar that the attackers will go to France. So maybe raise the bar so they will go elsewhere. Thank you.
Thank you very much.